Good evening, everyone. Slightly different accent for you. I'm obviously a West Virginia native rather than a Virginia native. I'm going to talk a little bit, and it follows on from what Kate said. One of the things Kate mentioned was about access to data, and one of the biggest challenges with access to data in today's market is not technology, which seems to have the great ability to share data, but government regulation or privacy regulations. Some of you may be aware that the final omnibus rule came out at the beginning of this year, was implemented on March 23rd of earlier this year, and for business associates, they had to be complying with it by September 23rd. So what does that have to do with me, I hear you ask? Well, there were some significant changes made in this law that significantly impacted business associates or small businesses developing mobile health applications. Most of the press focused around the negatives, and there are some significant challenges for small companies who want to be compliant with HIPAA. First off, business associates become directly liable to federal law, whereas before they were only liable to the covered entity they were working with. That's not a small step. That basically means that regardless of not whether you sign a business associate agreement, if the federal government decides that you're a business associate, then you're a business associate, and you can be fined significantly for any non-compliance. So you don't get away with saying I don't know, or I was clever enough to persuade my covered entity not to sign a business associate agreement. There's significant enhancements to individuals' rights to share data, and that goes to the point Kate said. You should really look into that, because individuals now have the rights to ask for their data to put into external electronic records, personal health records, etc. And that's a big change in the way that the laws move forward. Additional enhancements to the enforcement rule around willful neglect. Again, what that basically means is no longer are you just automatically penalised depending on the number of records that are breached. They're going to start looking at whether you actually did it deliberately. One thing about deliberate neglect, by the way, is claiming that you don't know, because if you're working in healthcare and you say that you don't know about HIPAA, they're going to declare that as being willful neglect. Okay? So you can't really just sort of duck your head in the sand and say it's not for me. You really have to understand what the law says and what you have to do to be compliant with it. Adopted changes to tiered civil money penalty structure. You can be fined up to $1.5 million for every single breach that you're responsible for. Now, again, going back to the previous point about how they negate this, if you're a small business and you're able to demonstrate some level of compliance, you're unlikely to be penalised to that degree. But don't delude yourself. If you get full fill of OCR who come and audit this, it's going to put you out of business if you're not taking the appropriate steps. And then introduced harm thresholds to breach notification. What this basically means is that previously, if you had any type of a breach whatsoever, you had to declare it. It doesn't matter whether it was a real breach or not. Someone loses a laptop with patient information, you have to declare it, whether or not that laptop was accessed or not. Now you can make a determination that says, hey, we managed to recover that laptop, or it was a mobile phone or a device, we were able to wipe it before we reasonably think anyone was able to access the data, so therefore we're not going to declare it as a breach. So you have more flexibility now in terms of what you determine as a breach, which is again a huge step forward for small businesses. As I said, the final omnibus rule became effective March 23rd, but more importantly, in September 18th, you have to be September 23rd, you have to be compliant. So how do you know if HIPAA applies? And this is the subject of an article I just wrote for Mobile Health News, because again, for me, the big news on the HIPAA omnibus rule was not about what, for people that are liable for it, what the penalties are. It's the fact that most people that think they're covered by HIPAA are not actually covered by HIPAA. Just because you're dealing with sensitive personal health information does not mean to say that HIPAA applies. HIPAA only applies to you if you're working directly for a covered entity and doing business and managing sensitive health information on behalf of that covered entity. If you've got a portal that's got health information, or any sort of service, a mobile app that's got health information, and your contract is directly with the end user, i.e. that end user signing into your service and agreeing to your terms and conditions, HIPAA does not apply to you. Okay? It only applies to you if you're operating on behalf of a covered entity and doing the bidding of a covered entity, and that end user has contracted with the covered entity and you're providing the service on that end user's behalf. And that's a really important distinction. When you look at the apps that are on the App Store, lots of the health portals that are going out there right now, a lot of these folks think that HIPAA applies to them. It doesn't apply at all. If the contract is with the end user, it doesn't apply. So what should you do? Does that mean to say because HIPAA doesn't apply that you should just throw out security? Absolutely not. I have an article on my website that you should take a look at. 5 things that any small business should absolutely do with regards to protecting their data. Step 1, the first thing you're supposed to do, and HIPAA stipulates this, and most security policies stipulate this, just make sure someone's responsible for security. Nothing's going to get done if no one's responsible, so you have to, step 1, make sure, and that's a mandate of most regulations. Don't think that because you're a small business that you shouldn't have policies and procedures. Better to have a policy with 1 line in it, or a set of procedures that are bullet points, than to have no policies or procedures at all. Again, over the course of time, these policies and procedures will build up to become something better. But if better to have a password policy that says, hey, you need to have a password. If that's the only thing you've written down, that's better than have no policy at all. And again, if you're ever in a situation where you are getting audited, you get credit for that. You get more credit for that than you will if you say, I just don't have a policy. So just start writing stuff down and just store it somewhere. That comes to the next point. Set up a single place to store it, The biggest friend, Google's here, I think, tonight. The biggest friend for any small business is Google Apps. Anyone who's storing stuff in Dropbox, come on, right? Personal accounts on Dropbox are not a way to store information. And so no problem with Dropbox, but if you read the privacy policy, especially if you sign up for a personal account with Dropbox, they have the right to review your data. Google Apps, you set up a Google Apps account, you have an intranet with a Google Apps account, you can store all your data. Make sure you run training programs. These don't have to be difficult. Get a monthly subscription to SANS, compile the information, just send it out to your staff. Very, very easy to do. And more importantly, again, if you do that through your Google Apps account, you've got demonstration that you're compliant and you're sharing that information. And finally, you have to follow up. You can't just set policies and procedures and then do no following up. If you have a ticketing system or even just a calendar system, right? For access control for any of the main policies, just set yourself a scheduled calendar reminder that once a quarter, once a month, whatever it is, that you have to go and do X. And just demonstrating that you're doing that, again, will allow you to demonstrate you're doing compliance rather than just not following up. If anyone has any questions about how to secure their business or anything related to information security, and I'm going to be here after, just come and ask. But again, the most important thing I can bear in mind is, if HIPAA applies, it applies and you have to be compliant. If it doesn't apply, you should still be compliant, but not for the same reasons. And if anyone needs help becoming compliant, I'm more than happy to help. Thank you very much.